Welcome to the deep dive. Ready to dive deep into the world of bugs and beyond?
Always ready.
But first, you know me, got to kick things off with a little gratitude boost. Primes the brain for all this awesome science stuff. So think of something, anything that makes you smile.
Yeah.
Like a really good cup of joe or, I don't know, like a puppy chasing its tail.
Got it.
Okay, awesome. Now on to the bugs. Today, it's all about Aztreonam. We've got some seriously cool slides from an infectious disease pro, chock full of insights.
I'm excited to break it down.
We're going to cover how it works, what it fights, and, just make it all make sense, even if you're not a microbe mastermind.
It's going to be fun.
So first things first, where did this Aztreonam even come from? Like, what's the origin story?
Well, picture this. It's 1979, and scientists discover this bacteria called Chromobacterium violaceum.
Okay, catchy name.
And they find out it produces these molecules, monobactams. They had, the potential to fight other bacteria, but they weren't very good at it at first.
So, they needed a training montage?
Exactly. Scientists got to work, tweaking, modifying the structure of these monobactam molecules.
Like giving them a superpower upgrade.
Exactly. They added specific chemical groups, and boom, they improved the activity and stability, like going from a slingshot to a laser beam.
So we've got our upgraded monobactam, Aztreonam, but how does it actually work? How does it take down those bacterial baddies?
Aztreonam, it's part of this group of antibiotics called beta-lactams.
Right.
And they all kind of work in the same way. They go after these things called penicillin-binding proteins, PBPs for short.
PBP's got it.
Think of PBPs as construction workers that bacteria use to, build their protective walls.
Essential for a bacteria's survival.
Totally. No wall, no protection, no party for the bacteria. Aztreonam, it's a specialist. It targets a specific PBP called PBP3.
Like a sniper, taking out a key target.
Exactly. It's like throwing a wrench into their construction site, preventing them from building their walls properly, weakens them, makes them vulnerable, and then, poof, they're gone.
Okay, time for a little pop quiz. Don't worry, no grades here, just checking if we're all on the same page. Here's the question. How does Aztreonam stop bacteria? A, makes them sleepy. B, messes up their DNA. C, stops them from building their walls. D, makes them explode.
Ooh, good one.
Got your answer. All right, the answer is C. It stops them from building those walls. Remember those PBPs, specifically PBP3? Aztreonam throws a wrench in there, and no more walls for those bacteria. Exploding bacteria, that's more of a Hollywood thing.
Right. Some other antibiotics mess with DNA, but that's not Aztreonam style.
And as for making them sleepy, I wish it were that easy.
That would be nice.
So we know how it works, but what kind of bacteria is Aztreonam actually good at fighting? Like, is it a generalist or more of a specialist?
It's definitely a specialist. It mainly targets gram-negative bacteria.
Gram-negative, okay.
Yeah, it's really good at taking down some of the big baddies like E. coli, Klebsiella, and even that super tough one, Pseudomonas aeruginosa.
Why is it so important that it focuses on those specific types?
Well, gram-negative bacteria, they're often trickier to treat than their gram-positive cousins. They have this, extra layer of protection, this complex outer membrane that makes it hard for some antibiotics to get through.
So it's like Aztreonam has the key to unlock that door and get inside.
Exactly. It's a valuable weapon when other antibiotics just can't get the job done.
But here's the thing. Bacteria, they're clever, right? Don't they sometimes find ways to, fight back against antibiotics?
You're absolutely right. Bacteria are amazingly adaptable. They're constantly evolving, and some of them, they figure out ways to resist antibiotics, including Aztreonam.
So it's like a microscopic arms race.
It really is. One way they resist is by producing these enzymes called beta-lactamases.
Beta-lactamases, whoa.
They're imagine tiny scissors that can chop up Aztreonam, making it useless.
Sneaky little buggers.
They also change their outer membrane proteins, these things called porins. They're like gatekeepers, controlling what goes in and out of the bacteria.
So they're changing the locks on their doors.
Exactly. And then there are efflux pumps, like tiny bouncers that actually pump Aztreonam back out of the cell.
Wow, so they've got a whole arsenal of defenses.
They do. And to make things even more complex, there are different types of beta-lactamases.
Oh, so it's not a one-size-fits-all situation.
Not at all. Aztreonam is really good against a specific type called metallobeta-lactamases, MBLs for short.
MBL's got it.
But it's susceptible to other types like ESBLs and AMPC.
So it's like even within the world of antibiotic resistance, there's a whole lot of variation going on.
Absolutely. That's why it's so important to do susceptibility testing. It helps figure out which antibiotics are going to be effective against a specific infection. You wouldn't want to send Aztreonam into a battle it can't win.
Makes sense.
Yeah.
Got to know your enemy, right? So we've covered how it's made, how it attacks, how those sneaky bacteria try to fight back. But how does Aztreonam actually get to the battlefield? Like, how does it travel through the body?
That's where pharmacokinetics comes in, the study of how drugs move through the body. Aztreonam, it's got some quirks. First off, it's not absorbed well orally.
So no popping Aztreonam pills with your breakfast?
Nope. It has to go straight into the bloodstream, either intravenously or intramuscularly.
Ah.
There's also an inhaled version for lung infections. Once it's in the bloodstream, the kidneys, they do most of the work of getting rid of it.
So important to know, especially for people who might have kidney issues.
Definitely. And here's another interesting thing. Aztreonam is time-dependent. To really work, it needs to be present above a certain concentration for a specific amount of time.
So it's not a hit-and-run kind of drug. It needs to hang around and do its job.
Exactly. And getting into different tissues, it varies. It's great in urine, which is good for UTIs, but in bone and cerebrospinal fluid, not so much.
Location, location, location. It's like sending troops to the right battleground.
Perfect analogy.
Okay, my brain's getting a little full here. Sometimes remembering all this info can be, well, a challenge. So let's create some mnemonics, those little memory tricks. For Aztreonam's mechanism of action, what about wall wrecker? It reminds us how it inhibits those PVPs, stopping those bacterial walls from being built.
Ooh, I like that. Catchy and accurate. What about for those resistance mechanisms?
How about scissors, gates, bouncers?
Oh, I love it.
Scissors for the beta-lactamases that chop up Aztreonam, gates for the porins, controlling what gets in, and bouncers for the efflux pumps, kicking it back out.
That's brilliant. Easy to remember and covers all the bases.
Okay, for side effects, how about RASH? R for rash, A for anemia or low white blood cell count, S for seizures, and H for hepatic, which basically means potential liver problems.
RASH, I like it. Short, memorable, and highlights the key points.
Now remember, serious side effects, they're rare, but it's good to be aware. And you know what, listeners? Feel free to create your own mnemonics. Makes learning more fun and helps it stick.
Absolutely. Get creative with it.
Okay, now that we've got those mnemonics locked in, let's talk about how Aztreonam is actually used in the clinic. What kind of infections is it typically prescribed for?
Aztreonam, it's often used for a bunch of different infections, the ones caused by those gram-negative bacteria we talked about. We're talking UTIs, bloodstream infections, also known as bacteremia, pneumonia, and even a condition called febrile neutropenia.
Okay, so break that down for me. What is febrile neutropenia?
So it's when patients have a fever, but their white blood cell count is low. Puts them at higher risk for infections.
Ah, so Aztreonam can step in and help protect them.
Exactly. And dosage, it typically ranges from 0.5 to 2 grams, given intravenously every 8 hours. But, it really depends on the infection.
Right. Got to tailor it to the individual case. It's fascinating how the dosage can vary so much.
It is. It really emphasizes personalized medicine, Each patient, each infection, it's unique.
Treatment needs to be tailored accordingly. Speaking of tailoring treatment, let's talk about one of Aztreonam's superpowers. It can be used to treat patients who have severe allergies to other beta-lactam antibiotics.
Right. Penicillins, cephalosporins, they're some of the most common antibiotics out there.
Yeah, but some people have, serious allergies to them.
And that's where Aztreonam steps in. It's got a different structure, so it offers a safe and effective alternative for those patients.
It's like having a backup plan when the primary strategy is off the table.
Exactly. Opens up a whole new world of treatment options.
But I remember you mentioned earlier that there are some exceptions to this.
Right. Aztreonam, it might have a slight chance of cross-reactivity with two cephalosporins, ceftazidime and cefiderocol. They share a similar side chain.
So it's not a foolproof solution, but it's still a game changer for many patients.
Absolutely. And it highlights the importance of, really understanding individual allergies and choosing antibiotics carefully.
Now, what about those MBL-producing bacteria? Aztreonam can be a real hero in those cases, right?
Absolutely. MBL-producing bacteria, they're often resistant to a lot of other antibiotics, making them, a serious threat.
But Aztreonam can handle them.
It can. Aztreonam's stability against MBLs makes it a vital tool. But it's important to note, not all bacteria-producing MBLs are going to be susceptible to Aztreonam. Susceptibility testing is still really important to guide treatment decisions.
So it's a powerful tool, but we've got to use it wisely. This is all incredibly fascinating, but I'm not going to lie, my brain's starting to feel a little full.
I know what you mean. It's a lot to take in.
Maybe it's time for a quick recap before we dive into the next part of our Aztreonam adventure.
A recap sounds good. Taking a moment to go over the key points can really help us solidify our understanding.
All right, listeners, we've covered a lot of ground today. We started with the origin story of monobactams, going all the way back to that colorful bacterium, Chromobacterium violaceum.
Remember that name.
Then we talked about how scientists took those early monobactams and transformed them into the powerful antibiotic we know as Aztreonam. They made some clever tweaks to its structure.
Like giving it a superpower upgrade.
Exactly. We learned how Aztreonam targets gram-negative bacteria by going after those crucial penicillin-binding proteins, especially PBP3. It disrupts their wall formation. And to remember that, we came up with a mnemonic wall wrecker.
Catchy, right.
Then we talked about how bacteria can fight back, how they can develop resistance to Aztreonam. They've got three main mechanisms: producing those beta-lactamases, modifying their porins, and using efflux pumps.
Remember, scissors, gates, bouncers.
Exactly. Then we explored the journey of Aztreonam through the body, pharmacokinetics. Learned that it can't be taken orally. It needs to be administered directly into the bloodstream.
And the kidneys play a key role in eliminating it.
Right. We also talked about the different ways Aztreonam is used clinically, from UTIs to pneumonia and febrile neutropenia.
It's a versatile tool.
And we talked about its unique role in treating patients with severe allergies to other beta-lactam antibiotics. It's a game changer for those individuals.
Definitely opens up new treatment options.
And of course, we can't forget those side effects. We came up with a mnemonic RAH to help us remember: rash, anemia, seizures, and hepatic.
Important to be aware of those, even though they're rare.
Exactly. We've got a lot more to cover, so we'll be back in a flash to continue our exploration of Aztreonam. Don't go anywhere.
Stay tuned. Welcome back. Ready to explore more of the Aztreonam world.
Totally. Let's jump right back into those clinical situations where Aztreonam really shines. We talk about patients with those serious allergies to other beta-lactams, but can you give us like a real-world example of how that plays out?
Okay, so picture this. A patient comes in, they've got a serious infection, but they've got a history of like a life-threatening allergy to penicillin.
Yikes, that's scary.
It is, and suddenly a lot of those go-to antibiotics are off the table. But then, Aztreonam enters the scene. It's a potential lifesaver in those situations.
Because of that unique structure.
Exactly. It's safe, it's effective, it allows those patients to get the treatment they need, even when other options are out of the question.
It's like having a secret weapon, when the usual tools just won't work. And it's not just about allergies, right? Aztreonam is also really important in fighting those superbugs we hear so much about.
Oh, absolutely. Those multi-drug resistant bacteria, they're a huge challenge. And Aztreonam, it's particularly good at fighting those that produce those MBLs we talked about, the metallo-beta-lactamases.
Right, the MBLs. They can break down a lot of other antibiotics, but not Aztreonam.
Exactly. Aztreonam, it's like a fortress against their attacks.
It's like the beacon of hope in this world where antibiotic resistance is like this constantly growing problem.
Yeah.
But how does that resistance even develop in the first place? It's mind-blowing to think that these tiny organisms can like outsmart our best defenses.
It really is. Bacteria are amazingly adaptable. They're constantly mutating, they're evolving, and those that develop these resistance mechanisms, well, they have a survival advantage. And when we overuse or misuse antibiotics, we're actually creating this breeding ground for these resistant strains.
So we're kind of accidentally making them stronger.
It's like we're training them to be more resilient, yeah. And that's why antibiotic stewardship is so important.
Right. Antibiotic stewardship. It's all about using those antibiotics wisely and strategically.
Only when they're truly necessary. That's the key to slowing down the development and the spread of resistance.
That makes sense. It's like protecting a valuable resource. But what does antibiotic stewardship actually look like in real life, in hospitals and clinics?
It's multifaceted. Education is a big part of it. Healthcare providers, they need to be up to date on the guidelines for antibiotic use, and they need to really understand, how to choose the right antibiotic for the right infection.
It was not just about prescribing antibiotics. It's about prescribing them thoughtfully.
Exactly. It's also about educating patients, making sure they understand why it's important to take antibiotics as prescribed to finish the full course of treatment.
Even if they start feeling better before they finish all the pills.
Yeah, I know it's tempting to stop early when you're feeling better, but trust me, it's really important to finish the course.
Why is that?
Well, stopping antibiotics early can actually allow some of those bacteria to survive.
Ah, so they can come back even stronger.
And they could potentially develop resistance. It's like giving them a head start in that evolutionary race.
That's a great way to put it. So it's really a team effort, right? Both healthcare providers and patients need to work together to make sure these antibiotics are used properly.
Absolutely. It's a shared responsibility. We all have a role to play in preserving these life-saving medications.
I want to hear about some real-life scenarios, like specific examples of how Aztreonam is actually used to treat infections. Can you walk us through a couple of those?
Sure. Let's say you have a patient with a complicated UTI, a urinary tract infection.
The UTI, okay.
They've tried other antibiotics, but nothing seems to be working. The infection just keeps hanging on. That's when Aztreonam might be a good option, especially if the bacteria is resistant to other drugs.
So it's like a backup plan when those first-line antibiotics haven't worked.
Exactly. Or let's say we have a patient with pneumonia, but they're also allergic to penicillin.
Oh, right. We talked about that.
That's where Aztreonam can really shine again. It's a safe and effective choice, especially if the infection is caused by a gram-negative bacteria like Pseudomonas aeruginosa. That one's often found in pneumonia cases.
Aztreonam is like a multi-tool. It can handle so many different situations.
It's pretty versatile, but like any tool, it needs to be used carefully and strategically.
And speaking of care, let's talk about those potential side effects again. Remember, RAS.
Good old RAS.
It's good to know that the serious ones are rare, but it's always good to be prepared. Can you remind us what RAS stands for and what those side effects might actually look like for someone?
Sure. So R is for rash. Could be something mild, like a little itchy rash, or in some cases, it could be more serious, like hives or swelling.
So definitely something to keep an eye on.
If you notice anything unusual, definitely talk to your doctor. A is for anemia or low white blood cell count.
Right.
This can happen if Aztreonam affects the bone marrow, where blood cells are made. Symptoms might include feeling really tired, weak, or even getting infections more easily.
So important to monitor blood cell counts during treatment.
Especially for patients who might already be at risk for those conditions. S is for seizures.
Seizures, yeah, that's a scary one.
It's rare, but it can happen, especially in people who have a history of seizures or if they're getting really high doses of Aztreonam.
Makes sense to tell your doctor about any pre-existing conditions, even if they don't seem directly related.
Absolutely. The more your doctor knows, the better. And finally, H is for hepatic, which basically means liver problems.
Liver problems, okay.
Aztreonam can sometimes cause liver enzymes to go up, which is a sign that the liver might be a little irritated.
So things like jaundice, dark urine, abdominal pain, those are all red flags.
Exactly. Those could be signs of liver problems, and if you notice any of those, call your doctor right away. Usually these liver issues are mild and they go away on their own, but it's always better to be safe than sorry.
Wow, we've covered so much ground today. From the nitty-gritty of how Aztreonam works to the bigger picture of antibiotic resistance.
It's been a whirlwind, but a good one. It's amazing how much there is to learn about this one antibiotic.
I know, right?
Oh.
And it really highlights how important it is to keep learning, to stay informed about these issues. They affect all of us.
Absolutely.
Now, before we wrap up this part of our deep dive, I want to bring back that thought-provoking question you asked earlier about the future of antibiotics. Those innovative approaches to combat antibiotic resistance. How do we make sure we have effective treatments for future generations?
It's the million-dollar question, isn't it? And to be honest, it's one that keeps me up at night. It's a global challenge, and it demands our attention. We need to be smart, we need to be creative, and we need to work together to find solutions.
It feels like we're in this, race against time, Bacteria are constantly evolving, and our antibiotics are slowly becoming less effective.
It's a powerful image, and it really highlights the urgency of this issue. We need to think outside the box. We need to invest in research. We need to find new ways to stay ahead of this evolving threat.
What are some of the most promising areas that researchers are exploring right now? Are there any breakthroughs on the horizon that give you hope?
There's a lot of exciting research happening. One area that's really promising is the development of completely new classes of antibiotics.
New classes? Wow.
Yeah, ones that target bacteria in totally new ways. Bypass those existing resistance mechanisms.
It's like finding a new weak spot, a new Achilles heel that they haven't figured out how to defend yet.
That's a great analogy. Another area that's really fascinating is phage therapy. Have you heard of that?
Phage therapy, I've heard of it, but I don't know much about it.
Well, it involves using viruses that specifically target and kill bacteria.
Viruses that kill bacteria, that's crazy.
It is. It's like using nature's own weapons against these infections.
So these they're like tiny little assassins.
You could think of it that way. They're programmed to go after specific bacteria, and they're incredibly effective. And there are other strategies in the works, too. Researchers are looking at ways to boost our own immune systems, to help them fight off infections more effectively.
So like training our own bodies to be more resilient.
Exactly. This could involve developing new vaccines or even immunotherapies that help our immune cells recognize and destroy specific bacteria.
That's amazing. It's like giving our immune system a software upgrade.
I like that. And this approach has so much potential because it's using the body's natural defenses, and it's less likely to lead to resistance.
This is all so promising. It's like it paints a picture of a future where we're not just, reacting to these bacterial threats, but we're actually being proactive, we're building our defenses, we're developing new strategies to stay ahead of the game.
That's the goal. And it's a future I'm really excited about.
It's inspiring to hear such optimism, especially when we're talking about such a serious global challenge.
It's a challenge, but it's one we can overcome. And I think our listeners, they get that. They're engaged, they're curious, and they want to be part of the solution.
They're definitely a smart bunch, and I know they appreciate your insights. It's been such a pleasure having you on the show today.
The pleasure's been all mine.
Okay, before we move on to the final part of our Aztreonam journey, let's do a quick recap of what we've covered in this section. We started by talking about those real-world examples of how Aztreonam is used clinically. Those cases where it's really a lifesaver, like for patients with serious allergies or for those fighting those tough MBL-producing bacteria.
Those are the situations where it really shines.
And then we talked about antibiotic resistance, that big, complex issue. We talked about how it develops, why antibiotic stewardship is so important, and how both healthcare providers and patients need to work together to use those antibiotics wisely.
It's a team effort.
And we revisited those potential side effects, RA-ish, just to make sure everyone's aware. And finally, we had that really interesting conversation about the future of antibiotics.
Lots of exciting research happening, new approaches, new possibilities.
It gives me hope that we can find solutions to this global challenge. This has been such an insightful and engaging discussion.
Yeah.
I want to thank you again for sharing your expertise with us.
It's been my pleasure. I love talking about this stuff, and I'm glad our listeners are as interested as we are.
They definitely are. Okay, we'll be back in a flash for the final part of our Aztreonam deep dive. Don't go anywhere. And we're back for the final part of our Aztreonam deep dive. It's been quite a journey, huh?
It has. From those tiny bacteria to, these global challenges, we've covered a lot of ground.
We have.
Yeah.
But before we wrap things up, I want to talk about something really important. What about the listener, the patient? What can individuals do to, contribute to this fight against antibiotic resistance? It feels like such a massive problem.
I get it. It can feel overwhelming, but honestly, even small actions can make a difference.
So what can we do?
Well, first off, I think it's about understanding how important antibiotics really are. These aren't just, any old medication.
They're lifesavers, right?
Yeah, literally. And I think that means, treating them with respect, using them responsibly.
So what does that look like practically?
Well, for one, good hygiene. It sounds simple, but it makes a huge difference. Washing your hands, covering those coughs and sneezes, staying home when you're sick, all that helps prevent infections in the first place.
So less need for antibiotics overall.
Exactly. And if you do get sick, if your doctor prescribes antibiotics, take them exactly as prescribed. Finish the entire course.
Even if you start feeling better before you're done.
Yeah, even then, stopping early, it can give those bacteria a chance to make a comeback, maybe even develop resistance.
Like we talked about before, you don't want to give them a head start.
Exactly. And remember, antibiotics, they only work against bacteria, not viruses.
Right. So taking them for a cold or the flu, it's not going to do anything.
Nope. And it can actually do more harm than good, It contributes to overuse, which then fuels resistance. Trust your doctor, follow their recommendations, and if you have questions, ask.
Communication is key. All right, so we've talked about what listeners can do. Let's do a quick review of those mnemonics we created. I love those. They're so helpful.
Me too. They're fun. They're easy to remember.
Okay, so for Aztreonam's mechanism of action, How does it target those bacteria?
Remember, it's wall wrecker.
Wall wrecker, that's right. Stops those bacteria from building their walls. And what about those bacterial defense mechanisms? How do they try to resist Aztreonam?
Think of those scissors, gates, bouncers.
Oh yeah, scissors for the beta-lactamases, gates for the porins, and bouncers for those efflux pumps. And last but not least, how do we remember those potential side effects?
RAH.
RAH, yep. Rash, anemia, seizures, and hepatic for liver problems. Important to know, even though they're rare. This has been such an amazing journey exploring the world of Aztreonam, from its humble beginnings to, its role in this global battle against antibiotic resistance.
I've loved it. It's been so fun to break down all this complex science and make it, understandable and engaging.
Me too. I always learn so much from these deep dives, and I hope our listeners do too. We've covered so much, how Aztreonam works, how it's used, those sneaky ways bacteria fight back, and even, what the future might hold for antibiotics. It's a complex topic, but it's one that affects all of us.
It does. And I think the more we understand, the better equipped we are to, to make informed decisions about our own health and the health of our communities.
Absolutely. So, to our amazing listeners, thank you for joining us on this deep dive into the world of Aztreonam. We hope you've learned something new, that you're inspired to keep exploring, keep asking questions. This is a conversation that needs to continue,
It does. Keep learning, keep sharing what you know. Knowledge is power, and we can all be part of the solution.
That's the perfect note to end on. Remember to like, subscribe, and share this deep dive with your friends. Let's spread the knowledge and work together to keep those antibiotics working for generations to come. Until next time, stay curious and keep diving deep.